Good morning, and thank you for joining us once again. I'm Kim McCoy-Wade, Director of the California Department of Aging, and I'm so thrilled to welcome you to our webinar Wednesday, this time focused on emergency and disaster preparedness and response as part of our Master Plan for Aging engagement with the public on input and recommendations. Welcome to our series. Believe it or not, this is our 6th one. This is our informative and interactive series of webinars to address the variety of aging-related topics that inform the development of the Master Plan for Aging, which I'll talk more about in just a second. We welcome you to join us every Wednesday from 9:30 to 11 from now until the end of April. We're always having a single topic that we've heard is a priority from the community, ranging from housing and homelessness, transportation, retirement security, and many other topics. Each week, we feature one of our state partners, a local leader, and a member of our stakeholder advisory committee, all of whom are sharing personal stories, data, programs, services, and ultimately recommendations. You can visit engageca.org to find the link for each webinar and options to join by phone, and of course, all the materials afterwards to catch up too. But right at the heart of these are hearing from you. We are going to be running polls and questions throughout the webinar to find out who's here, to find out what your priorities are and what your recommendations are, and the chat box and the question box are open throughout as well. I'm going to say a few things about Master Plan to get us grounded, and the first poll will run to start to find out who's here. And I'm delighted to welcome who's here of our all-star speakers. You can see in this previous slide, we've had a wonderful lineup covering all kinds of topics on our major goals: livable communities and purpose, health and well-being, and economic security and safety. And today we are turning to emergency and disaster preparedness and response with our lineup of Director Karen Fees from Sonoma County, who I believe has the honor and of course challenge of probably presiding over the most disasters of any county services director. So she has incredible wisdom and advice for all of us that we can learn from. Our good state partner, Vance Taylor, the chief at our Office of Emergency Services of the Office of Access and Functional Needs. And Anna Acton, who has many roles. She is the executive director of the Freed Center for Independent Living up in Nevada County. She is serving as a member of our LTSS, Long-Term Services and Support Subcommittee, and is a close partner with our SAC member, Christina Mills, head of the California Federation for Independent Living Center, who is unable to be with us today. So thank you in advance to Karen, Vance, and Anna for what's to come. But first, a few words about the Master Plan for Aging. The master plan was called for by our governor, GAVIN Newsom, last June by executive order, where he tasked the Health and Human Services to convene both a stakeholder advisory group and the cabinet to create a master plan. Had to be data driven, so a research subcommittee and a real focus on the services and supports that allow Californians to live in homes of their choice with a long-term care subcommittee. Why did the governor do this? Partially look at the data. These population charts show us that California, like the nation, is aging. Over time, these population charts are one way of representing the age of population. At the bottom, you see people who are 0, our newborns, and all the way up to our 100-year-olds. And on the left are the males and the right are females. And you can see as recently as 1989, there were kind of a pyramid shape, with a lot of people in California clustered around 20 or 30s because of our high number of campuses and military bases. But over time, last year, 2019, we're starting to, as more and more of us live longer, and there aren't necessarily more babies coming behind, that we're starting to look more like a pyramid. And then you fast forward to 2049, and again, there's more of us and more of us living longer into our 80s and 90s. I keep getting these wonderful questions from people, so I'll go ahead and answer it now. Some of you may see a little bit of a different color of a red on the blue side and blue on the red side. That's where there's more men than women or women than men. So if you look at 2049, there's particularly at the higher ages, 70, 80, 90, 100, more women than men. That's what we see when we look at the data. The other exciting piece about the data is how much California is diversifying. The diversifying of California has long been a trend here, and it will finally start to catch up with aging Californians, as aging California will diversify like the rest of the state in coming years. And this brings so much to the table, so much richness in diverse racial and ethnic and cultural traditions. But it also brings a challenge to our plan to make sure that it is not just culturally competent, but culturally relevant, and that all the needs for access and information come through trusted community partners in multiple languages, and really this is a plan for all of California. Just a little more on the data. A slide from our partner, Dr. Stephen Wallace at UCLA, shows that in 2010, you can see, this is a complicated chart, so I'm going to spend a minute on it. You've got two things going on here. One, you can see that 38.1% is the percentage of the older Californian that are people of color in 2010, 38.1%. By 2060, that grows to 67.1%, majority people of color heavily, you know, 2/3 by 2060. And then you can see in the different colored bars, the growing diversity among different racial and ethnic groups. So while the bottom bar, which is bright pink on my slide, of white older Californians, excuse me, grows just slightly from 2.6 to 4.2 million, not even doubling. The green bar at the top of the two bars, Latino any race, grows from less than 1 million, 0.7, to 5.5, growing by a tremendous factor closer to 8. So again, the population, not only are there more of us aging, the population is aging, is diversifying as well. One other piece of the diversifying California, of course, is the legacy of racism and other systemic discriminations, which shows up in our income disparities and disability inequities among our elders over 65. Dr. Wallace shares these two slides. If you look here at income disparities, you can see, looking at both poverty and near poverty, which given the cost of living in California is a better look at what it takes to thrive here in California. Latino, African American, and American Indian elders, close to 40%, around 40% are poor or near poor. On the next slide, disability inequities, you see that Latino and Asian communities have disability rates significantly higher than African American and white. Again, changing what the face of aging and the needs of aging look like. So that's what we want to make sure that we're doing, is not just building a master plan for more, but also really grappling with that aging is changing. We have more diversity. We have more of us living alone, particularly in the LGBTQ community, who may or may not be estranged from a family of origin. But in general, given family patterns and economic patterns, more of us are living alone and not with our extended families as we age. More at risk of poverty, as we just talked about. And excitingly, there's so much more awareness of the stages of aging as we're living through our 60s, 70s, 80s, and 90s. Each of those eras is a different stage with different opportunities and different challenges. And how do we bring all that together to make the Golden State the best place for your golden years? Well, here's how our Stakeholder Advisory Committee has advised us so far. Let's have a vision that's broad, a California for all across the lifespan. And let's be sure we're grounded in our values of choices as we age, equity encompassing age, disability, geography, income, race, ethnicity, immigration, language, religion, sex, gender identity, sexual orientation, and family status. Dignity and disruption of ageism and other biases. Inclusion and accessibility, innovation and evidence, both the best of the future and the best of our past history, and very strong partnerships. The governor's quite clear this is not a plan for state government, this is a plan for all of us, government and private sector, state and local. To that end, here's our mission: to deliver a person-centered, data-driven, 10-year California Master Plan for Aging by October 1st this year, with the components of a state plan, but also a local blueprint that's meant to be the toolbox that you can use with your community to either advance your plan or help get a plan together. Data dashboard of state and local data, so we can all be data-driven, and best practice sharing among communities. One of the best parts of my job is traveling the state and learning of all the wonderful things happening out there. Just in San Bernardino County yesterday, and how do we share that, lift that up, and spread that so all of our communities benefit. We are tackling 4 huge goals of aging: services and supports, so we can all live where we choose as we age and have the help we and our families need to do so. Livable communities and purpose. We all want to live in and be engaged in communities that are age-friendly, dementia-friendly, and disability-friendly. Health and well-being. We'll live in communities and have access to services and care that optimize health and quality of life. And economic security and safety. Today's focus: we will have economic security and be safe from abuse, neglect, exploitation, and natural disasters and emergencies throughout our lives. Where we are in our process for all that is, I dare I say, we're not quite halfway, thank goodness, but we've been just so overwhelmed and overjoyed by all the input we're hearing from the public comment, the recommendations, the community roundtables, the subcommittee meetings, and now these webinar Wednesdays. Soon we'll hear from our stakeholders with a report on long-term services and supports. And we'll be synthesizing all those recommendations this summer to be ready for October 1st. These webinar Wednesdays are a critical part to hearing from you and getting all the pieces right. With that, I want to turn to our topic at hand and just say a few words about both CDA and the master plan's engagement with this topic. California Department of Aging does oversee a number of local programs. So our traditional role in disasters has been to support our providers and partners. We've shared the resource guide, most recently around the power shutoffs, and provide guidance to our local area agencies on aging and other direct service providers so they can help serve the people they serve. And of course, we've been working very hard with our aging and disability resource connections to make sure that there's no wrong door for emergency information. We're excited in our new role as the convener of the master plan process with our agency. We were able to partner with the Governor's Office of Emergency Services, the very own Vance Taylor you'll hear from shortly, to convene a cross-department meeting around with all state departments about how we do emergency preparedness to serve older adults and people with disabilities. That we met for the first time last week, hot off the presses, and more to come. We're very excited about that work underway. We've also heard the topic a lot from around the state. And as I said, one of the part of the master plan is to go listen and hear. And we were very happy that Grass Valley, Nevada County welcomed us. Jan Arbuckle is on the city council and also a member of the master plan stakeholder advisory committee. She and I hosted a meeting and Anna, we'll also hear from, was there to hear about many rural topics, of course, transportation, volunteerism, but there was a deep focus on the emergency preparedness given the recent PSPS and wildfire experiences. Some of the considerations we heard from the community, the challenges around communication, phone service not being reliable, broadband possibly not being available at all, and how warning systems work in very remote areas. Other rural and remote challenges for disaster response, the roads, again, the internet and phone service, evacuation routes may be very limited, one way in, one way out, and it's certainly an issue up in Butte County. And temporary shelters, how does that work so they are accessible for all? Jan also wanted to share, she was unable to be with us today, but she also wanted to share two of her real takeaways from the last two last disaster experiences. One, the preparedness checklist. You know, her real takeaway was preparedness begins long before any communication or alert. That having a real self-sufficient set of tools, such as you see listed here, ranging from flashlights to batteries, all the devices and their chargers, particularly if there's medical equipment, medicines are important. And then the other piece is, as much as government is central in emergency disaster response, having those connections, having that buddy system of families, neighbors, and friends is also a particular takeaway that Jan Arbuckle had. So having shared those introductory comments, and thank you to all of you who've been weighing in already, I do want to turn it over to our experts. Let's start by seeing who's here from our polls, and then we will introduce Karen. Who's here today?
Great, thank you so much, Kim. So during Kim's introductory comments, we launched 3 polls to get an idea of who is on this webinar, and I'm going to go ahead and report out on those. So the first question we asked you, are you an interested member of the public or employed or involved in fields of aging or emergency and disaster preparedness or response? 45% of respondents indicated that they are employed or involved in fields of aging. 21% of respondents indicated they are an interested member of the public, and 18% of respondents indicated they're employed in fields of emergency and disaster preparedness or response. The second question we asked, what age group do you belong to? 34% of respondents indicated that they are between the ages of 45 and 54. 24% of respondents indicated they're between the ages of 65 and 74. And 12% of respondents indicated they are between the ages of 25 and 44. The third and final poll that we asked, where in California do you live? 22% of respondents said they're from the Bay Area. 20% of respondents indicated they're from the Sacramento region. 18% of folks said they're from the North Coast, Northern California area, and 16% hail from the Los Angeles area. So thanks very much for responding to those polls, and please be looking for polls as we continue.
And thank you. That was Adam Willoughby, our communications director here at the Department of Aging. Thank you so much. Without further ado, let me introduce to you Director Karen Fees from Sonoma County Human Services Department.
Thank you very much for having me. Appreciate it very much. As was mentioned, Sonoma County has had its share of disasters, unfortunately, lately. And I'm going to explain a little bit about that. But first of all, let me explain for those of you who don't know where Sonoma County is very briefly. Sonoma County is along the coast about an hour north of San Francisco if there was no traffic. And so it's a beautiful area and lots of vineyards, trees, lots of, it's just a beautiful place to live. So let's talk about the 2017 October wildfires. This was really our first experience. Oh, let me preface it by saying I've been with Sonoma County Human Services for 34 years, 4 of which as director, and I call those the disaster years. So, so we do have a lot of experience. So October 2017 was our major wildfires. And wasn't just one fire in October of 2017. We had multiple wildfires, some counts up to 250 small fires, but the major one being the Tubbs fire that you see on the screen and the Nuns fire. We call those the Sonoma complex fires because there were so many fires. And in total, there was about 245,000 acres of fire and over 5,600 homes lost, including my own. And I'll go over that in a little bit. We had 44 deaths attributed directly to the fires as well. So my personal story, just very briefly, I don't want to speak too long on this, is that I did lose my home in the Tubbs fire. And the Tubbs fire started in Napa County and came over into Sonoma County. So it was a fairly large fire. We received no alerts. Fire came over at 1 o'clock in the morning, woke up just because I'm a light sleeper, smelling smoke. The winds were howling, lots of weird noise. Went to basically evacuated neighbors, woke up neighbors, and we basically got out of our house and we realized by 2 a.m. that morning, so less than an hour later, our house would have been gone at that time. So we do have, I'm not going to tell a lot about my personal story in great detail. I'll mention it here and there, but we do have some links posted if you would like to know more about my personal story. There's a video and actually a book that my husband wrote, a graphic novel. So those are available to you. And I'll refer again back to it. But it was a very personal experience that led me to understand what individuals who lost their homes and everything they owned went through that night. So when I left at 1:30 in the morning, I went straight to my office because I knew that I had work to do in my office because I don't think any of us understood the magnitude of the fires at that time. And we just kept hearing more and more as time progressed that day. And so what we realized was that we were just not prepared for that fire of that magnitude. We had been preparing, as all counties do, for disaster preparedness, but I don't think anybody could understand that magnitude. Again, as I mentioned, there were no alerts or very few alerts that went out in the community. So people were pretty much scrambling because of the fires, multiple fires. There were access and egress routes that were disrupted. But one of the wonderful things is we have a very strong leadership in Sonoma County, especially in the Human Service Department. We have long-term managers who jumped into action, and we created our own communication between management level with staff and with the community. Mobilizing staff was a challenge because the fires really did occur from October 8th through October 31st. So fires were just kind of coming and going all the time. And so sometimes we'd have staff come in and then they'd have to leave because they had to get evacuated again. I had some staff evacuate like 3 and 4 times during the course of the October month. in 2017. And frankly, one of the easiest things for me was I already knew my house was gone. I didn't need to worry about it any further. So mobilizing staff was tough, just making sure we had enough people, because we had to make sure that we had staff to actually maintain services. We pulled in mutual aid from people to take our call center, and also staff from other neighboring counties. We provided disaster services, including Disaster CalFresh. Human service, social service agencies are required to be care and shelter to manage those. And so we set up shelters, and including making sure we had training for everybody, supplies, had to work with the animals that were coming through as well. And we also in Sonoma County have a children's shelter that we had to evacuate in the middle of the night, which was a challenge but successful. And luckily it was not destroyed. But maintaining services was a challenge. That fire, it was kind of crazy, but we did as well as we could for the time, and we're proud of our response at the time. So in 2019, just last year, we had, and I'll talk about kind of lessons learned that led to this, but in 2019, we had another series of disasters. In February of 2019, we had the Russian River, which goes through Sonoma County, flooded. We are actually really good at flooding in Sonoma County, because flooding happens a lot. And so it's fairly localized, and so we're really quite good at that. But what a new disaster event that happened, and I will call them disasters because they respond like disasters, are the public safety power shutdowns, or the PSPS events. We had 4 PSPS events in October, starting on October 9th. And we had the first one on October 9th, we had 66,000 residents impacted. Of those, 4,000 were deemed medically fragile. And so we started making phone calls. We made about 1,400 phone calls for that first event. We had another one October 22nd, where we had 28,000 people, 1,200 being medically fragile. On October 25th, again, 93,000 people, with 3,300 people who were deemed medically fragile. And October 28th, we had 87,000 people impacted, or 2,900 medically fragile. The reason I want to bring that up is because we ended up diverting approximately 80 members of our staff to work with making phone calls and responding to IHSS clients and consumers and other individuals who are medically fragile. And that was quite a bit of work on our part. And we had learned a lot of lessons in our 2017 wildfires, but we did a series of calls. And then if we needed to, based on their answers to phone calls, we did home visits with them if needed and brought them supplies. Now, some of these PSPS events went on for several days, and sometimes we had to make multiple calls to individuals depending on how they were doing at the time. After the second PSPS event, we had the Kincaid fire. The Kincaid fire was huge in volume. We had to evacuate from Sonoma County 200,000 people, and our population is a little less than 500,000. So it was a significant portion of our community that we had to evacuate. I myself had to evacuate out of my brand new home. That was fun. We had moved back by that point, and we evacuated. It was a much larger in volume fire for the Kincaid fire. It was almost 78,000 acres. And so it was almost 3 times the size of the fires we had in 2017. But because of the lessons learned, we only lost 120 structures and we had no deaths, which was incredible. It was amazing. Some of the things that had changed is we had alerts. Alerts came every 5 seconds, it felt like, at the beginning, in multiple languages, in multiple ways, emails. We had our 2-on-1 system set up to respond. It was just much better in response. So we had a much better event or outcome of our Kincaid fire last October. So some of the lessons learned, and that picture on the slide is a picture of my home in the rebuild process. So about a year after the 17 fires. So the lessons learned that we figured, well, is always be prepared for a disaster, but disasters are crazy and you need to be flexible. Having an executive leadership of the county, of your office, whatever the case may be, you need to have that set up for multiple communications on a daily basis. We realized that we needed to have better plans. We purchased equipment such as cots because we couldn't rely necessarily on the Red Cross getting cots to us as quickly as we needed them. Financial tracking was really super important. As I mentioned, communication, we had done much better in terms of alerts, languages, different modes and modalities of communication to different levels of partners and staff, leadership, etc. We wanted to increase our training, and we did, between the 17 wildfires and the 2019 wildfires. We mandated care and shelter for every one of our staff. Before we thought an adequate number. No, every one of our staff needed to be trained in fundamentals of care and shelter. And then we needed to train many, many people in access and functional needs so that they could respond to our vulnerable populations and really make sure that they were taken care of. And then evacuation drills, simple things like that. We're still working on staffing because you never know when a disaster strikes how your staffing will be impacted personally. We also learned about self-preparedness. We've made a plan that every one of our IHSS consumers would have a evacuation and emergency plan within the year after the the 2017 fires, and they were well prepared for the Kincaid fires. So we have a plan for every one of our consumers. And we are also working on preparing for future PSPS events. We're still in the process there. But just really having coordination and ahead of time for disasters themselves. Recommendations that we have is, again, preparedness, we're really mandating plans for people and to have self-preparedness, not solely rely on government assistance immediately. Plans include documents of what they need, individuals need in case of evacuation, including medications, medical equipment, things like that, emergency contacts, and collaboration, really working with partner agencies, whether it's PG&E for PSPS or others, local and state agencies. Encourage older adults and people with disabilities to form support communities, to encourage neighbors to look out for one another. Again, that was really a major part of our success for my neighborhood and making sure we got out in 2017. We talked about training, which we want to say is a recommendation, and establish emergency backup systems for caregiver support when caregivers are unavailable. We also want to look at additional IHSS hours, especially as a result of the PSPS events. There was really a lot of need for emptying and replenishing refrigerators after prolonged power outages, for example, and maybe looking at adding a set number of hours for providers working in a designated disaster or PSPS region, or maybe a timesheet code for disasters and PSPS events. There's many things that we can continue to provide recommendations for. We had mentioned before cell phones. Cell phones go down in fires and in PSPS events, and we're all working on it, but we're, I think, much better off than we were before. Thank you for the opportunity to speak on this.
Thank you, Karen, for sharing both the devastation of the disasters and the repeated devastation and trauma, but also the hope that comes from getting better and the improvements in the preparedness and in the ultimate outcomes in terms of lives lost. So that does give us great hope that these preparedness conversations can make all the difference. We want to share what we're hearing from you. Of our participants today, we've got about 100 folks taking the polls. 40%, over 41% say yes, you have experienced one of these circumstances. We have lots of people who have experienced the public safety power shutoff. Sausalito, Berkeley Hills, San Rafael, Napa, Santa Clara County, lots of folks experienced that, some for days. We also have people who've experienced fires in Santa Barbara County and the related mudslides. down there. And of course, the fires up in Shasta County as well. So we have people who have directly experienced that. And flooding, also flooding down in San Jose a couple years ago with creeks that overflowed, devastating flooding in a small area there. So we do have a diversity of participants here with direct experience. That said, when we asked if you have an emergency kit, we appreciate your candor, but only 60% of you said yes, 40% said no. So thank you to all of you who shared that you absolutely do. The people who do mention water and food, but also people talk about how they're adding things to it. Sherry talks about not only at home, but in her car and in her office, she has separate kits in all 3 locations. Lisa talks about how every year, not only does she refresh the water and food, but she's expanded it. She's got a solar powered radio, pet supplies, increasing more and more resources. And Crystal talks about, lots of you talk about lanterns and candles, but also backup chargers. So thank you to Crystal for shouting that out. And many people talk about the grab and go. Again, back to Director Fee's comment about not a lot of time, in a tub by the door, in a backpack, ready to go. I personally, September 11th is the thing I most lived through on the East Coast. I was not in New York, but near it and had to move quickly. And so every year, September 11th, I refresh my bag. That's my personal anniversary for when I refresh my bag. So all of these tips from folks about do it now, get started with something, expand it as you can, and refresh it every year are really, really wonderful. I'm sure we have more tips from our next speakers, so I'm going to turn it over to them to keep the conversation going. I am delighted to introduce one of our state's leaders and national leaders here at California Office of Emergency Services, our Chief Office of Access and Functional Needs, Vance Taylor. And we think it's so interesting. Karen became a director 4 years ago when all this started. I came to state service 4.5 years ago running the CalFresh program when all this started. And Vance, I believe you took office 4.5 years when all this started. So all of us have been through, from different perspectives and different seats, several experiences, and we are eager to hear more. Vance, take it away.
All right, thanks very much. And I'm delighted to be taking part in this webinar. And thanks everybody for signing on. I recognize that anytime we do something online, you're competing with Netflix. And so the fact that you're here is great. I appreciate it, and we'll keep this party going. So I'm Vance Taylor, and I'm the Chief of the Office of Access and Functional Needs at Cal OES. And if we move to the next slide, I just want to talk and tell you a little bit to make sure we're all on the same page about, when we hear access and functional needs, what exactly that entails. We're talking about individuals who have developmental, intellectual, or physical disabilities, but we're also talking about chronic conditions or injuries, limited English proficiency, people who are older adults, children or in late stages of pregnancy, living in institutionalized settings, low income, homeless, or transportation disadvantaged. And so we recognize that as we look at each of these populations, it's a lot of people that make up each individual group. And when you take each of those individual groups and you put it on top of a map of California, which has 40 million people, that we're talking about an enormous amount of individuals. And of course, among the fastest growing of all populations are older adults. And so for older adults, this conversation about emergency management and the role that access and functional needs plays is essential. And so I appreciate everybody logging on. Let's go to the next slide. It's important for us to understand the reality of this issue. And to do that, all you have to look at is the history, how exactly our nation has gone about traditionally responding and even preparing or recovering from disasters. And the fact is, we've done so without really considering or integrating the needs that people with access and functional needs have. And so we would have the scenario where we're going to evacuate a town. And so we send a bunch of school buses. And we tell everybody, get on the school bus and go. But if you show up and you're in a wheelchair and ask, well, where's the accessible bus? And there isn't one, then you recognize very quickly that planning with the access and functional needs perspective in mind did not occur. And not only did that type of planning, but not only was it common, but it resulted in fatalities and in physical and emotional hardships. And we saw this put on bright display during Hurricane Katrina, as we witnessed that 70% of everyone who died had an access or a functional need. And so it gave our nation pause to stop and look at this issue. And in California, as California often does, leading the emergency management landscape, we can go to the next slide. The governor decided to be proactive and create the Office of Access and Functional Needs. Let's see, can we move to the next slide? There we go. And the office was created in 2008. And in essence, the office exists in order to identify what do people have in terms of needs. So if we're talking about older adults, what are the needs that older adults have? What are the needs that people with disabilities have before, during, and after disaster? And then once we start to get our arms around that, we work to integrate those needs throughout every facet of the state's emergency management systems. And that's a big job. And it takes an entire community of government and individuals and private sector and community-based organizations working together to achieve. But that's how we approach it. And we recognize that the degree to which we're able to really move that forward results in lives saved. It results in people staying independent and healthy and secure, and to individuals being able to maintain their dignity throughout the entire emergency process. Let's go to the next slide. So I'm going to talk a little bit about these three big buckets that we find become problem areas really regardless of the type of disaster we're talking about. So whether it's a wildfire or a flood or an earthquake, we find that for people with access and functional needs, these three areas continue to be challenging. So number one, emergency alert, warning, and notification. We, as emergency managers, haven't always thought about how people receive information, right? We tend to think people receive information the way we receive information. So if I get my information through Twitter, then I assume that if I push out information on Twitter, everybody will get it. If I receive my information through the newspaper, then I just assume a press release means everybody will get it. And the reality is that people get their information from a wide variety of sources. And so we have to be very conscientious and deliberate in how we push out life-saving information. And technology plays a really big role in that. We have to be able to know how to reach people. right? So technology allows us the ability to send very specific information to very specific individuals. And so let me give an example. So I use a wheelchair, and if an emergency alert were to be sent out to myself and to my neighbor would grab a bag, throw it in the car, jump in her car, and take off. I would have to call a care attendant. We'd have to pack and gather my durable medical equipment, medicines, anything else I might need. Then either an attendant would drive me, or we'd have to wait for an accessible van, bus, or paratransit system to come pick me up. So it takes me a lot longer to be able to evacuate, and it's a lot harder for me to evacuate than it is for my neighbor who doesn't have a disability. And so the role that technology plays in helping us identify who needs that information the soonest, whose window to evacuate is the narrow list. And so we're working on ways to do that. We're also working to make sure that as we communicate that it is effective. So if it's a text message or an email, that it's written using straightforward language, using fonts that are large and colors that don't get blended into one another. If it's a press conference, we want to make sure there's a ASL interpreter. And of course, we put things out in different languages. So people have to know what a disaster is. They need to know what to do and how to respond. And all that falls under number one. Number two is evacuation. So now I've got my information, right? I know that I've got to go somewhere, I've got to get out. But how do you get out, right? If I were to ask any emergency manager throughout the state, how many people in your local jurisdiction are going to require accessible resources to get out during a disaster? And I don't think one of them can give me an answer. So if you don't know how many people in your community are going to require assistance, and how do you plan for the gap between how many people are going to need help versus how many people you can actually move with the resources you have? So for government partners on the line, I would say you need to look at your surrounding communities, and whatever other groups have resources can set up MOUs and MOAs so that they can serve as a force multiplier during evacuation. For individuals on this line who are thinking about evacuation, I would say that you need a plan to go 5 people deep. And what I mean by that, again, using my own example, I can't drive, and so I'm going to rely on somebody else for that. So number one on my list is my wife, right? She loves me, she's a fan, so she'll help. My mom lives in a neighboring community, so she's on my list. My neighbor is on my list. A colleague at work is on my list, and a friend from church is on my list. I cannot expect that any one of those 5 people is going to be available to help me at a moment's notice. But I can expect that of the 5, right, so somebody can, and so that's what we have to plan on, is having a support network that allows for that. And then lastly, it's sheltering, right? We look at shelters, and from the government perspective, I look at shelters and I think they need to be physically accessible, right? We got to be able to get in, got to be able to maneuver throughout the shelter, but they've got to be programmatically accessible as well. And what that means is we've got to have shelters that allow for people to get assistance feeding, taking their medicines, showering, transferring in and out of a bed or a cot, providing durable medical equipment if devices are broken, lost, or misplaced, or they were lost in the disaster. And so we work really hard on that front. What I would tell you as individuals is to look for shelters that are community sponsored, in other words, by local social services, Red Cross, in local emergency management, as opposed to a pop-up shelter, which might be a local church, which are good people doing good things, but who don't maybe have all the resources to be physically and programmatically accessible, like an entity like Red Cross or your local social services would have. And also think about what you're going to need to take with you. Right, when I go on a trip, I make a list and I put it on the door. That way, when I'm rushing to get out the door, and I'm trying to make it to the airport, I can remember what I need to take. Right, feed the dog, turn off the stove, that sort of thing. We need to do the same thing for disasters. Have a list. You can't be expected when somebody says, "Get out or you're going to die," to be rationally thinking about every single item we might need. So come up with your list beforehand, put it somewhere you can see it, and then run down that list before you leave your home. Let's go to the next slide. I want to tell you on this next slide, we're talking about LISTOS, California. This is essentially the governor invested $50 million to help boost disaster preparedness, specifically among traditionally what we would call historically vulnerable Californians. So please, keep an eye out for LISTOS, California. They're working with community-based organizations across the state, and they're doing some really great work there. On my last slide, I really just want to say that I recognize that this is a challenge. This is tough. We've got more and more disasters happening every year. The scope, scale, and level of devastation is increasing. But as we work together as community-based organizations, as local government partners, as state agencies, as individuals from the community, as the whole of community together, we can achieve great things. We can do this. We will do this. And that's how we build a greater, stronger, more resilient California. So thank you for your time. Thanks for tuning in. And I hope that was helpful.
Very much so. Thank you, Vance. And thank you again. Another speaker sharing both their professional expertise and their personal experience is so powerful. I want to share from our participants as well. Jack reminds us that, of course, people who are living in continuing care facilities and other residential facilities, those places have requirements as part of licensing to have plans for disaster preparedness. And so those are critically important to stay on top of course. And as more people are living at home for longer, needing to make sure disaster and emergency plans are there as well, as Director Fees mentioned in terms of building into the IHSS program, that home and community-based living needs to include disaster and emergency preparedness on the natural. And Sybil also highlights in our poll about who would you rely on in an emergency, number one answer, 60% said a partner or a spouse, and 43% said adult family members. The third answer was neighbors at 41%. But as Sybil says, lives alone, no family nearby, which is the case for more and more of us as we age. So if we are living at home, so we don't have the residential disaster plan, if we are living at home without a partner or adult family members near, what is our plan? And so again, the neighbors, the friends, the five deep, as Vance said, all become more and more important as our aging population changes. One great question came in for Barbara that I'm going to open up to Karen, and Vance, if you want to chime in, you may, but the question was about cognitive impairment. And we know that Alzheimer's and all dementias are spreading. Behavioral health challenges are also increasing among our aging population. There's a range of cognitive impairments. How do you plan for to serve people with cognitive impairments? And Barbara says, what specific training or plans did you put in place or you think are needed to address the needs of people living with cognitive impairment? Karen?
Thank you very much. You know, that is a really tough question. If individuals in our community, for example, are IHSS consumers, we know who they are and what their needs are. As Vance mentioned, sometimes we don't know our community. And in my personal opinion, cognitive impairment is the largest gap in services for older adults and people with disabilities. It is something that we grapple with every day to better understand and to respond. There aren't specific programs specifically for cognitive impairment. And oftentimes we don't know who they are. So again, we try to create a network. If individuals are on IHSS, they do have a plan in our community. We are working to increase training on a regular basis for staff and caregivers, but it is a huge, huge gap for all of us.
Vance, is there anything you would like to add either now or in follow-up on serving people with cognitive impairments?
Sure. So, you know, we do individual outreach, but a big part of our outreach is to work with the entities that might provide services to individuals who have cognitive disabilities. So the State Council of Developmental Disabilities, regional centers, day centers, or day programs, independent living centers, the Mind Institute, and others, to ensure that there's a level of consistency in what we're talking about in terms of how individuals should be preparing, with the recognition that everyone has a different capability or capacity to prepare for themselves, but that each of us should be doing what we can, and then we need to be providing support to bridge whatever gap exists between that and where folks need to be.
Thank you. We'd now like to turn to our stakeholder representative, Anna Acton, who's the Executive Director of the Freed Center for Independent Living and has her own experience and expertise to share with us. Anna.
Thank you so much, Kim, and thank you, Karen and Vance, for your presentations. My name's Anna Acton with Freed Center for Independent Living, one of 28 independent living centers in the state of California. So first, I'm going to go over the role of the Stakeholder Advisory Committee. So the Stakeholder Advisory Committee is made up of 34 representatives from various agencies, organizations that span both aging and disability. The role of the committee is to inform and advise the California Health and Human Services Agency and cabinet level work groups on aging in the development of the Master Plan on Aging. So as part of this process, we have reviewed the public comments and recommendations that have come in to the Department of Aging. So specific community members have responded around emergency and disaster preparedness. There was actually 16 or 2% of the public comments from individuals in the community were around emergency and disaster preparedness. As well, there have been multiple other comments and recommendations provided from agencies and organizations throughout the state on emergency preparedness. So my hope here is to kind of summarize what we've heard from individuals in the community, agencies, and organizations around this topic. So I am a member of the Long-Term Services and Support Subcommittee. And this group of us is working together to kind of pull together recommendations submitted by agencies, organizations, and be able to provide that summarized list of recommendations to the Stakeholder Advisory Committee. We also have a research subcommittee that's looking at research topics, best practices. We have an equity work group because that is important to ensure we're considering equity throughout the entire process and throughout the recommendations. And then we're all reporting back to that Stakeholder Advisory Committee. Next slide, please. So I wanted to start with a couple stories from the community. So as Karen was talking about October 2017 and the fires in Sonoma County, there were additional fires that sparked up in Nevada and Yuba counties as well, which is some of the areas that my organization serves. So I think they were considered the wind complex fires throughout the state because there were strong winds that led to fires throughout the state. So in Nevada County, we had the Lobo fire that started in early October at the same time Karen was talking about there in Sonoma County. And we work very collaboratively with our offices of emergency services in multiple counties and have a really strong collaboration. So there was a couple in their 80s with an adult daughter who had a developmental disability. The husband was a paraplegic and the wife, also in her 80s, was a primary caregiver to her husband. They were evacuated from one of the communities impacted, threatened by the Lobo fire. And when in their haste to evacuate, he evacuated without his power wheelchair. He was able to get into the vehicle and they sped away to evacuate the flames. So they went to a hotel in the Yuba and Sutter, Marysville, Yuba City area. And he had no wheelchair, but luckily the hotel actually had a wheelchair, a manual wheelchair, kind of hospital wheelchair that he was able to utilize. But what he found quickly is that he could not transfer from that wheelchair to go to the bathroom, to get into bed, because he didn't have a specialized equipment with him that he had in his home. Even just a simple thing as his power wheelchair had an armrest that moved out of the way for him to be able to transfer, and with the hospital wheelchair, that wasn't possible. So he called the emergency operations center requesting assistance with transferring in and out of bed, maybe a bedpan so that once he got into bed, he could go to the bathroom. And he said he was willing to go to the shelter or go wherever he needed to go to be able to get that support and assistance. So he really was strongly stating that he wanted to stay with his wife and his daughter. Again, he would go to the shelter, he would stay at the hotel, wherever he needed to go to be able to get that support. So when he called the Emergency Operations Center requesting assistance, there was no clear path to be able to provide that personal assistance for him, either in the hotel or in the shelter. So Freed, as a community partner, organized quickly to get a personal attendant into his hotel room who helped him transfer in and out of bed, go to the bathroom, and then the next morning, he was able, the evacuation orders were lifted and he was able to go home. The reason I tell that story is because, one, the importance of having personal attendance services available. The only option without that personal attendance services would have been for him to go into a nursing home. And those were discussions that were being had at the county level. And so you can imagine with him in this crisis situation and really wanting to stay with his family, that going into a nursing home at that time would have created a lot more steps for him to be able to get back home. And he would not have been able to stay with his daughter and wife. The second story I wanted to tell was around the PSPS, Public Safety Power Shutoff events that happened just last year, October 2019. And there was a gentleman who called and he said that he was on SSI, it's the end of the month, he had no income, he was on an oxygen concentrator that had a 4-hour battery life. So he had to find power every 4 hours to keep his oxygen flowing. He had a truck that used a lot of gas. He was out of money, and he was really at a point where he felt like he could not do this any longer. He was exhausted. I said, well, what did you do during the last power shutoff event? And he said, I had to drive around every 4 hours desperately looking for power so that I could re-plug in my oxygen concentrator. And he's like, I just cannot do it anymore. I'm exhausted and I'm done. So we were able to get him into a hotel with power, and so that he could stay throughout the expansion of the PSPS events, which in Nevada County lasted 6 to 7 days, depending on where you lived. So 2 quick stories from the community to kind of keep us grounded in why we're here and what we're trying to accomplish. Next slide. So I have looked at the various recommendations, again, that have come in from individuals, organizations, and agencies, and also building off of what you heard from both Karen and Vance. I wanted to go over what we have heard from the community on these different topics. So I also broke them up into those 3 buckets that Vance compiled stuff into: notifications and warnings, evacuations, and sheltering. Specifically around notifications and warnings, we've heard that an individual really would like us to require captioned emergency alerts. So again, you heard from Vance about how notifications and warnings need to go out in multiple different formats so that people can access that information. And this is one example of ensuring that captioning is available for alerts. This could be on TVs, for example, so that people who are hard of hearing or deaf can also receive those alerts. We also have heard from multiple different community members around notifications being confusing and hard to understand. I mean, we know the situations. We're in a crisis, maybe. There's maybe a short amount of time to be able to give accurate information for people to take action. But we've heard both from disaster notifications as well as the power shutoff notifications that the messaging can be confusing and people do not quite understand what they need to do or when they need to do it. So ensuring that that information is easy and transferable for people to take action. Around evacuations, we got comments specifically from community members about transportation, both to be able to evacuate, including accessible transportation, as Vance mentioned, those transportation equipped with wheelchair lifts, but also the importance of access to transportation to services while sheltering. So ensuring that there's also a mode in place when people are in shelters to be able to get to a medical appointment, get to a pharmacy, get to basic services and necessities. We heard Vance talk about going 5 deep, and we talk about it in terms of having 5 trusted allies. So who are your 5 trusted allies? Those are individuals, family members, like we already discussed. Now, I have gotten quite a bit of feedback from people, older adults, people with disabilities, who are like, 5 people. I mean, we have to be honest that there's a lot of individuals who are really isolated in our communities, maybe geographically or socially, and finding 5 trusted partners can be really difficult. But we want to start with at least the concept of finding your allies, right? So 5 is the number that is amazing. It would be great to have that level of support, but can you at least get 1, 2, or 3 trusted allies that are going to check on you during a disaster and might even help you with evacuation? We also heard about sheltering and both physical and programmatic access, and then emergency backup personal assistance for anyone, including those on IHSS. The story from the Lobo fire kind of demonstrates that need, that we need to arrange for that personal assistance services in a shelter environment for people. And I know that can be an especially tricky situation, at least during the different disasters that I have collaborated with my counties on. And I've heard stories throughout the state, but it's something I think that we really need to tackle. We have multiple stakeholder input on IHSS, and having an emergency backup IHSS system for personal attendance. Next slide. So there were a lot of recommendations around personal preparedness, and you heard that today, and thank you all for your great input on this topic. So I think that what's really important to know about personal preparedness is that, one, it is the responsibility, right, of the systems, of the counties, of the state to ensure that access and functional needs, people with disabilities, older adults are planned for, right? And that every part of a county's disaster plan includes access and functional needs. And every activity, those pieces are woven into it. But what we also know from multiple disasters is that we have to personally prepare. When you look at the number of first responders that are available during any given major disaster, there's only so much capacity in the system to be able to assist anyone who might need help. And so it really is important, while we work on the systems change issues and we get our capacity together, we also have to take our personal responsibility on this and personally prepare. And these things include, having the plan like we talked about, know where your evacuation routes are, know where meetup locations are for your family members or friends if you have to evacuate and there's lack of available communication systems. Make sure to take your equipment and medication. Vance talked about that. I talked about it in my story, but if there's any possibility to take your medications, take your equipment, you're going to be a lot more independent on the other end, in the shelter and in the recovery phase. It's really important to coordinate, have coordination between state and local outreach, education, and planning. So how can we partner together with the regional centers, with the other Meals on Wheels programs, with those that are already a trusted partner of older adults and people with disabilities to help them with personal preparedness. Of course, the LISTOS campaign was mentioned. That's one example of really targeting personal preparedness. There was also recommendations about requiring organizations, state-funded programs that target aging and disability to include personal preparedness activities as part of their program implementation. There's also specific feedback on managed care plans and the role that they need to play in helping develop and maintain personal emergency plans with their members. This also includes IHSS recipients, of course. How do we put in systems into place for these programs that support this community to assist with that personal preparedness and planning? And lastly, there was recommendations on supporting people in getting emergency kits. We know that this it can be costly for individuals if you're on a fixed income. How do you set aside extra food or money or supplies when you're living on that fixed income? So is there support that we can provide for personal emergency kits? Next slide. So I'm going to speak a little bit to the public safety power shutoffs and the recommendations received. So reaching out to socially and geographically isolated populations is going to be critical during these kind of events. There was recommendations about requiring managed care plans to provide alternative methods of powering life-sustaining equipment, right? So Vance in his power wheelchair, right? Why wouldn't the health insurance managed care plan be able to provide additional backup battery systems for individuals who rely on the power wheelchair, the oxygen equipment, or whatever, ventilators and electric beds and things like that that people require to stay healthy and independent. So looking at how managed care plans can support individuals. Again, for that backup power system for durable medical devices and assistive technology. And it's important to note that, I think the backup power systems, there's a broad range of needs in the community. So there are individuals, if you could go back one more slide, there's individuals who could use a backup power charging station to power a ventilator or power an oxygen machine, but there's other people who some of these portable backup power generation devices aren't going to be sustaining. Some people really need whole house systems to power their medical devices or keep them cool or warm. Transportation to power was a critical piece that we got feedback on for those that do not have their own transportation. We also have some of the utility companies providing community charging stations, and that's really looking at having those open 24/7 instead of just 8 hours a day. The gentleman I told you about on oxygen, I think, is a prime example. If he had a local place to go to, right, any time during the day or night to recharge his equipment, that would have been a lot less stressful for him. We saw a lot of people that lost substantial amounts of food. And so having a disaster food assistance through CalFresh, which we did see during some of those last PSPSs in October, were critical, right? How do we get people's food replenished when it's gone bad during a power shutoff? We also, there's been recommendations about developing microgrid resiliency hubs. So we saw that in a couple of communities, like in Grass Valley, where the utility company kept the downtown community charged and with power, which meant that basic necessities were available to the community as a whole, and the hospital and the nursing homes and the assisted living and some of the hotels now were powered, and that made a huge difference for our community. Requiring communication utilities to have a backup power is another key piece. We saw phone lines go down, cell phone towers go out during the public shutoffs, really kind of highlighting the need for those communication utilities to have sufficient backup power so we can stay in communication during power shutoffs. And then we also saw some major issues around availability to oxygen supplies, both for people in the community who needed oxygen tanks replenished and didn't get deliveries of them during power shutoffs, to facilities, residential facilities who also were struggling with keeping enough oxygen supply. So next slide, please. Okay, so these recommendations are around coordination and collaboration. Karen made some really good points about training for county staff, and I wanted to build off of that. So training for county staff, including access and functional needs, as well as developing functional assessment service teams. We call them FAST teams. These are individuals trained in disability and aging and that work together to ensure that people's needs are met in the shelters and during the disaster. We also had recommendations that you heard from Vance as well around developing memorandums of understanding for collaboration across agencies. So ensuring that your transportation partners, that you are on the same page and you know how you're going to work together during a disaster. This also could go for other community-based organizations that might be able to support during a disaster. Partnering with the managed care plans and community-based organizations. There's also recommendations about the role of managed care plans, again, in establishing a call center and emergency communication and service protocols. So what are the managed care plans doing to ensure their members that they know are dependent on power are getting their needs met during a disaster or during a power shutoff? Next slide. Okay, so that kind of wraps up the input that we've heard from those that have submitted comments through Together We Engage, which I want to thank everyone, both individually, organizations, and agencies that have provided input. I want you to know that that input is being reviewed. There are many people looking at that and trying to organize it and coordinate it together into some succinct and precise recommendations. So I really appreciate everyone's input into this process. And with that, I'll turn it back over to our facilitator.
Wonderful. Thank you so much for sharing those recommendations. One thing I want to note is that a number of resources have been mentioned on this call that are helpful both for personal preparedness as well as for government and partners preparedness. And so we are going to add a slide to this deck that has things like the California Health and Human Services Resource Guide for PSPS and MySafeLA and other OES recommended resources and other speaker resources. So we'll add a slide to the deck when it's posted that has kind of other resources. They've been shared in the chat in real time, but we want that to be memorialized. So thank you for keeping it coming. I want to share one comment in advance. I'm going to ask you a question in a second about earthquakes. Lisa makes the great comment that she sees these emergency kits that we're talking about. She's seen them at fairs. She hears about them, but we have to acknowledge how expensive they are. To truly be comprehensive, it's an outlay of resources to keep them maintained. And so how do we make sure that these are accessible and affordable for everyone and not just out of reach from a financial perspective? So that's an excellent point from Lisa. So Vance, I wanted to give you a second. You know, the last 4.5 years that we've all been focused on has really been about fire, flooding, mudslides, and of course the PSPS, the power shutoffs of the last year. But we can never forget in California earthquakes. And of course, there are many people on this call who may have been in California or even lived through personally the Northridge or the Loma Prieta quakes that hit our state. Is there any additional advice or information for earthquakes that you might want to share? I mean, in some ways, all disasters require the same building blocks. In some ways, each disaster is different. Any reflections on earthquakes to add?
Yeah, and it's great. Thank you for bringing that up. So look, you know, we don't want to scare anybody, but the reality is it's California, right? So it's always earthquake season. And we saw on Ridgecrest that earthquakes happen, large ones happen. And so as we talk about preparedness, we really can't emphasize enough that people need to be doing things now, right? When we talk about things like, hey, have some backup food, have a go bag, have a kit that's ready with the things you need, try and get backup medicines, try and prepare yourself. Keep a little cash on hand, have a support network in place, have a sense of how you get out if you needed to. All of those things are things that you should be answering right now. And when it's required to make purchases, we get a lot of people on fixed income, and it's tough. And so you kind of get a little bit, but every time you go to the grocery store, pick up one thing. Right? Every month, do a little bit, and in the next couple of months, you'll find that you're in a pretty good spot. The more prepared you are for a wildfire or a flood or a PSPS event, the better you're going to be prepared for an earthquake, and vice versa. I always tell people to think about the consequence, right? So if there's an earthquake and you have power outages, the consequence is you're out of power, right? And everything that means. Well, if you have a PSPS event and you lose power, it's the same consequence. If there's a wildfire and power gets lost, it's the same consequence. And so the cause doesn't quite matter in the same way that planning for the consequence matters. And so, look, we've got some guidance, and you can check that out on our website. That's very specific to earthquakes. But the reality is that there are parallels in preparation, how they relate across the entire disaster spectrum. But if you're prepared for earthquakes or PSPS or wildfires or floods, then you are in a much more prepared and resilient state for all hazards.
Thank you. That framing is very helpful to focus on the consequence, not the cause. And to that point, you know, the reminder that our neighbors who live in Ridgecrest and Trona, months after those earthquakes, are not able to inhabit their homes. And we have a Christine on the call here realizing that could be her in Santa Cruz if there was an earthquake. Could be months and months and months. The consequence, not the cause, is really where we need to focus. With that, I want to wrap us up and just call two things to your attention. One, our continuing series of Webinar Wednesdays. Very excited next week to tackle isolation, inclusion, and respect, looking at everything from purpose and meaning in our life to behavioral health to ageism. Abuse and neglect, exploitation up the week after. Returning to our community spaces, parks and community spaces, and civic and social engagement. And then next, tackling the real shortages in geriatric medicine and how do we make the entire health profession ready to serve our aging population. Lastly, I'll point you back to our new website, engageca.org, where you'll find all the information you need for upcoming webinars and the slide deck, the recording, the video, and that bonus slide with more resources posted in coming days so you can continue to share. And please weigh in. Thank you for all your poll answers, your comments, your chats. We welcome your emails, your recommendations as we continue to gather your input and build a master plan for all. Thank you, and see you next week.